Welcome to Dr. AI. I'm Dr. Robin Blackstone, and this is the Foundation of Health 4.0 series. Each week, Dr. AI and I will trade perspectives on how intelligence, ethics, and culture can rebuild trust in health. In this first episode, we go back to the beginning, to the moment that started it all, my presidential address as the first woman president of the American Society for Metabolic and Bariatric Surgery, and the question that would redefine my career and the future of medicine. Today, I explore the genesis of Health 4.0 and how it will become the operating system for health in the 21st century. The long arc of reform. A decade ago, I wrote Blueprint for the Future of Metabolic and Bariatric Surgery as an act of realism and hope. The field had reached a crossroads. Our procedures were safer, our outcomes better, our understanding deeper. Yet our systems remained fragile. We were curing diabetes one patient at a time, but failing to transform the system that produced those patients by the millions. The blueprint called for a shift in mindset, from procedure to platform, from individual excellence to systemic intelligence. It urged surgeons and health leaders to build networks of transparency, continuous learning, and long-term accountability. At the time, this was a radical idea, that surgery could be the model for a more intelligent, trustworthy health system. A new definition of success. The blueprint recognized that obesity is a chronic metabolic disease, not a failure of will. Surgery was not the finish line, but one tool in a lifelong metabolic journey. To succeed, the system needed to build accredited programs with measurable outcomes and feedback loops, create data registries for long-term safety, effectiveness, and quality of life, foster continuous quality improvement as a culture, not a checklist, design care models where follow-up, behavior, and community were as integral as the operation itself, and establish effective medications for treatment, not for diabetes per se, a downstream consequence of the root cause of elevated blood sugar, but of the obesity and inflammation that was its genesis. These principles foreshadowed what we now call Health 4.0, a living, learning health system that uses intelligence to guide care, not bureaucracy to control it. From weight loss to metabolic health. The field's early emphasis on weight loss was understandable but incomplete. The real revolution was metabolic, the recognition that surgical intervention could reverse insulin resistance, alter gut hormones, and transform the trajectory of chronic disease. That insight broke open a new frontier, one that called for integration across specialties, payment models, and public health. It required systems thinking, how to deliver metabolic health, not just surgery. Looking back, this shift prefigured today's global debates about prevention, AI-enabled risk prediction, and personalized metabolic therapies. The blueprint's message? Move from reactive rescue to proactive intelligence. And that is even more urgent now. The core shifts we still need. Number one, we need to shift from accreditation to trust governance. What began as centers of excellence should evolve into transparent, data-rich systems governed by trust and ethics, the foundation of the H4 Alliance trust. Number two, evolving from registries to intelligent data lakes. Longitudinal registries taught us what worked. Today, AI and Health 4.0 architecture can turn those static databases into living ecosystems of learning, the H4 Alliance data and insight engine. Number three, follow-up evolves to lifelong connection. Where the blueprint called for better follow-up, we can now create dynamic, personalized engagement through digital platforms and AI agents like Dr. AI, guiding individuals across prevention, proactive care, and rescue medicine. And number four, surgical leadership evolves into system leadership. The specialty that pioneered quality and safety metrics is poised to lead again, this time across the entire continuum of care. Metabolic surgery becomes a case study in intelligent, equitable, effective, culturally aligned system design. Where the blueprint meets Health 4.0. Today's Dr. AI initiative and the H4 Alliance are, in essence, the next chapter of that blueprint. They expand its logic from one specialty to the whole of healthcare, linking prevention, proactive intelligence, and rescue medicine through connected, ethical, and culturally aware systems. Data infrastructure becomes the digital nervous system of care. Accreditation evolves into trust-based governance. Longitudinal outcomes feed intelligent learning loops across populations. Equity and culture become structural determinants of success. What began in the operating room has matured into a national framework for comprehensive AI-enabled health, guided by the same values of accountability, evidence, effectiveness, and human dignity that defined the original blueprint. Why does this still matter? The 2013 article that reflected my presidential address and the work of the years leading up to that, not only by me but my colleagues, is now more than a historical artifact. It's a lens on how transformation begins. Every innovation we celebrate in Health 4.0, real-time data, personalized pathways, AI-guided ethics, was seated in that early call for transparent, evidence-based, system-integrated care. We cannot rebuild public trust in health until we rebuild the system itself, not as a market or a bureaucracy, but as a living organism that learns from every encounter and improves with every iteration. That was the premise of the blueprint. It refines and remains the moral and practical foundation of Dr. AI, Reimagining Health, and the H4 Alliance. Looking forward, the future of metabolic and bariatric surgery, and indeed all of medicine, is not about what we cut, but about what we connect. Our task now is to complete the evolution that began in that blueprint, to build systems that were intelligent, transparent, and aligned with the values of the people they serve. Because comprehensive health is not a privilege of treatment. It is the architecture of trust. About the author, Robin Blackstone, MD, is a physician, systems architect, and founder of Blackstone Health, the H4 Alliance, and Blackstone Press, a global initiative to build intelligent, equitable, and culturally aligned systems of care. She is the author of Dr. AI, Reimagining Health, and the original blueprint for the future of metabolic and bariatric surgery. Her work connects medicine, policy, and technology to rebuild trust in the global health enterprise. Thank you.